Pulmonologist. A pulmonologist, also known as a pulmonary disease specialist, is a medical doctor who specializes in the diagnosis and treatment of diseases related to the respiratory system, which includes the lungs, bronchi, trachea, and respiratory muscles. Pulmonologists are also experts in the management of conditions that affect the breathing process, such as asthma, chronic obstructive pulmonary disease, COPD, lung cancer, pneumonia, tuberculosis, and other conditions that affect the lungs, bronchi, trachea, and other parts of the respiratory system. Pulmonologists have extensive knowledge and training in the anatomy, physiology, and pathology of the respiratory system. They use a range of diagnostic tools and techniques, such as pulmonary function tests, imaging studies like X-rays and CT scans, and bronchoscopy, a procedure that involves examining the airways with a flexible tube. Based on the results of these tests, pulmonologists can make a diagnosis and develop a treatment plan tailored to each patient's unique needs. Pulmonologists diagnose and treat a wide range of respiratory conditions, including asthma, a chronic lung disease that causes inflammation and narrowing of the airways, making it difficult to breathe; COPD, a group of lung diseases that cause airflow blockage and breathing difficulties, including chronic bronchitis and emphysema; lung cancer, a type of cancer that develops in the lungs and can spread to other parts of the body; pulmonary fibrosis, a lung disease that causes scarring of the lung tissue, leading to shortness of breath and coughing; pneumonia, an infection of the lungs that can cause fever, cough, and difficulty breathing; tuberculosis, a bacterial infection that mainly affects the lungs and can cause coughing, chest pain, and fatigue; sleep apnea, a disorder in which breathing repeatedly stops and starts during sleep, leading to poor sleep quality and daytime fatigue. Pulmonologists use a variety of diagnostic tests to evaluate respiratory conditions, including pulmonary function tests, PFTs, a series of tests that measure how well the lungs are functioning; chest X-rays and CT scans, imaging tests that allow the pulmonologist to visualize the lungs and surrounding structures; bronchoscopy, a procedure in which a thin, flexible tube with a camera on the end is inserted into the lungs to examine the airways and collect tissue samples; arterial blood gas, ABG, testing, a blood test that measures the oxygen and carbon dioxide levels in the blood. Once a diagnosis has been made, pulmonologists work with their patients to develop an individualized treatment plan that may include medication, oxygen therapy, pulmonary rehabilitation, and/or surgery. They also provide ongoing monitoring and management of respiratory conditions to ensure their patients receive the best possible care. Pulmonologists may also work closely with other specialists, such as thoracic surgeons, oncologists, and critical care physicians, to provide comprehensive care to their patients. In addition to treating respiratory conditions, pulmonologists play a vital role in preventing and managing chronic diseases, such as smoking-related lung disease. They work with patients to develop healthy lifestyle habits and provide education on how to manage their condition and prevent exacerbations. Pulmonologists may work in a variety of settings, including hospitals, clinics, and private practices. They may also conduct research on respiratory diseases and conditions, working to develop new treatments and improve existing ones. In summary, a pulmonologist is a medical doctor who specializes in the diagnosis and treatment of respiratory diseases and disorders. They play a critical role in helping patients manage and overcome respiratory conditions, improving their quality of life and overall health.